an ask by the Obama Biden Transition Project to have community forums on the health system in this country and how it might be improved.
But healthcare is a right. It is not a privilege, and it is not a consumer marketable item.
I really think the government needs to seriously look at trying to do something like that. Because we've got too many people that don't have average coverage that causes the health care to skyrocket. And I think that might be beneficial.
But we are aware that, of course, we all get older. And no matter how great your health is now, what's going to happen 20, 30 years from now? You know, when we have dementia or whatever.
First off, I think if we get the insurance, we don't need the insurance companies. They don't solve no problem. And most of the drug companies don't, in a sense, other than just inventing drugs.
And I think that the drug companies are a real big problem as well. Yeah, it's all to do with money, and what Bella was saying as well, you know, the whole chemical thing is set up to form an imbalance in your system, and then they give you more chemicals, and the drug companies are just making so much money.
They'll tell you not everything you will do possibly. They'll tell you all the side effects, possible side effects. Some of the side effects, that's the only reason they're telling you. Because if you listen to those side effects, you will see that a lot of those side effects are worse than the disease you may have. I mean, up until now, I mean, they got a lot of nerve.
More than 10 years ago, I used to do medical billing under the Clinton administration. I was Sharon Casey. And I watched the HMOs come up under the Clinton administration. And I watched as they said one thing and did another, and it was very disheartening.
If you ever really want to get to the root of how healthcare works, and start making it a rational system again, we have to start putting real prices on things. In any other place, if you went to the gas station and they said, wait, we got to figure out how much we're going to charge. Give us your credit card, and we'll tell you how much we're going to charge you in a week or two. We wouldn't do it. But that's exactly what's going on. So in my world, the way you start to bring rationality to this is start saying, how much does it cost to run your business? How much does it cost you on the low side if everything goes perfectly? And what are the conditional factors? Like what happens if you have to go to an ICU after a surgery? But that's rational. You can put that on a piece of paper and say, here's how I come up with my numbers. And I get that there's private hospitals that aren't bound by the nonprofit rules. But if we started with the nonprofits doing that, and we started with the people who wanted to have it be rational, I think that the pressure of the market would drive people to doing the right thing.
All right, you know. Yeah. And every other poor country, from little Denmark to Belgium to even Maine, has it, you know. There's little no complaints. And the only reason this country doesn't have it is because, like the lawyers, the doctors, the EMA, whatever, the other one, the black medical doctors, they're all money oriented. Now, money, they're not human oriented, they're money oriented. And you got to think that's that. Now, when anything they put out there, I don't care how good it may sound initially, you better believe if they authorize it, their association went for it. It is to make some money, but not just them, for the whole medical industry, and for the insurance industry, which is even worse than they are about money. You know, case in point, you know, 780 tons of drugs, and they're even more money crazy. I mean, I like money. I really have money. I don't know that. But what I'm saying is, I really capitalist system today, but I do believe in it, and not cutthroat capitalism. I do believe that this is the, you know, people should come first, foremost, and I don't just mean certain people who are disabled or people who are poor. I mean everybody in the damn country.
Can't you speak logically in this term, in this position, about our medical system? Because we need to dissect the layers. It's not just passing legislation. We have to understand why we need to change this, a complete overhaul. I want the legislation, but I need to know and be educated as to why. And most people, and I have to accept, I have to say this, because I'm not meek, I'm not shy, do not understand what I just explained. Do not understand themselves in the medical profession. So why is it that some doctors are not coming out of the black hole and they're looking at organic products, at non-chemical based, herbal, natural products? Why is it that this marketplace of natural and organic products, non-chemical based, are under attack all the time by the U.S. Congress? Why is it that marijuana, for medicinal purposes or not, is always under attack? Because political situation has nothing to do with what is good for the gander is good for the goose, or vice versa.
I spent about 30 years as a pastor, so, I was at the bedside of a lot of folks, and mental health issues really need to be a part of our care system. They've been neglected. Many of the social problems we have with the homeless, we all know now some of the veterans issues, but mental health has to become a part of our strategic service plan for people. And
recently, you were seeing studies where now a majority of doctors recognize that our present system is not working. That's the polite way to say it. And so they are becoming more and more interested and supportive of a single payer system.
good.
Well, I just wanted to make a couple of comments myself. Now that we're wrapping up this community discussion on healthcare, a number of issues came up that I sort of wanted to respond to. One, Laura said as she was leaving something about a dearth of doctors, that there are need for more medical schools in this country. You see a lot of countries that have a much higher percentage of doctors per capita than we have. And there's no reason except that the AMA has a lock on how many doctors are allowed to graduate every year, and therefore that keeps them at a high income level. Now, I have no problem with doctors being paid well. It's very important work that they do. Hello. Great. And feel free to join us. Anyway, I do think it's important that we make healthcare more available by having more doctors. And the way you do that is you establish more medical schools. And there's no reason why we can't do that. No reason. I had some other comments I wanted to make, but we have a new gentleman who's joined us. Okay. Well, that's right. So the thing is that I organized this thing, and I want to make sure everybody has a chance to speak.
So you will get to speak.
Okay. Sort of wrapping it up, but anyway,
And I'm looking forward to universal health care because I've seen what happens when they don't get it. For 5 years, when I worked for the Kidney Foundation of the Upper Midwest, I recruited about 250,000 volunteers to go out and solicit people for organ donor cards. And unfortunately, just recently, my first wife passed away, and she was able to donate all of her organs because she signed a card back in 1971 to donate her organs. So it finally paid off for probably 10 or 15 other people.
Look on your TV, they're so arrogant with their commercials and advertisements.
That's what I.
thank you, Francis. Thank you for your help, Marilyn.
I am